I'm your host, Dr. Ben. Well, in today's session, we get to talk more about anxiety. And recently, I had a question from a client asking, "Hey, Dr. Ben, can you tell me when anxiety begins in an individual's life?" And that is a very good question. Do you know the answer? So, according to your behavioral science research, this can happen as early as the fetus being in utero, so essentially being in the mother's stomach, tummy. And so what happens is that there is a hormone known as insulin-like growth factor 2. And so let's say the mom isn't feeding well, overly stressed. All of this passes on to the baby via the what we call the placenta, correct? All right. So basically, if the mom is stressed, as I said, not feeding well, there's low levels of the insulin-like growth factor 2, and this is where the trouble begins. So the baby picks that up, and having low levels of insulin-like growth factor coupled with increase in the stress hormone known as cortisol. So all of this gets pumped via the placenta to the unborn child. So the unborn child, or when the child comes into this world, you notice that they may have a low birth weight, number one. Number two, they tend to be sensitive. And number three, they end up developing into having attention deficit disorder. So these are the children that would go to school and have trouble focusing on schoolwork. And for parents that are not aware of what is happening, they may end up scolding that child or saying, screaming, "You need to do your work, you need to focus." And that just seems to add more fuel to the fire. So it is essential for parents to really understand what's happening and know that therapy does make a big difference in helping children who may have attention deficit to be back on the right path. So generally speaking, these children also become anxious. Again, as I said, very sensitive. And all of this is being programmed, called the placental programming. I know that sounds very scary. Yes, we are programmed as early as being in our mom's womb. Just take a second to digest that statement. As early as being in our mom's womb, the programming begins. So I'm going to take you now and show you a model of a brain. And so we're discussing about anxiety and how, or areas in the brain that are responsible, things like depression as well. I'm going to give you a nice picture of how to see the brain and to see where these things begin, these emotional disruptions. All right. So here is a nice brain model, and you can see the left hemisphere and the right hemisphere. And so this area right here in the front is called the prefrontal cortex. And this typically develops when an individual is in their early 20s. It could actually push to the mid 20s. So why is this area important? You ask the question. So according to neuroscience and neuroimaging, the left prefrontal cortex right here is what holds our positive emotions, and the right prefrontal cortex holds our negative emotions, correct? So if an individual sustained, God forbid, head trauma, injury to the left prefrontal cortex, all they have left is to deal with the right prefrontal cortex. So these individuals typically struggle with things like persistent depression. emotional dysregulation issues, just feeling under the weather, not knowing what really the meaning is to life because all they have to deal with is just all these negative emotions on the right side to compensate. So with anxiety, there's another structure that is very common, prominent, and that's called the amygdala. So you ask a question, Dr. Ben, where is the amygdala located? So you just picture your ear, the right ear and the left ear. It's just slightly above that. That's where you'd find that structure. And so in individuals that are highly anxious, that area is kind of lighting. It's, if you do a scan of the brain, you see that there's a lot of activity in that amygdala region, and it's enlarged. And so these individuals show signs clinically of anxiety. And so let me take you to how this works. So in the real world setting, these individuals are either living in the past familial or the future familial. So what happens is that being stuck in either the past and thinking and having emotions related to things that are in the past emotions, hurts, or catastrophizing the future or living in the future. So something has to be familiar to you, either the past or the future, but the present time is where you need to actually be in to really escape being stuck on either poles and really living in that emotional dysregulation and past present hurts. So it's important for individuals to really practice mindfulness, as I mentioned in my last video, and just really living in the now, being grateful, and not allowing yourself to be drawn to what has been programmed, the familial past or the familial future. And this can be further enhanced by having therapy because, we're talking about very complex emotional patterns here that need to be explored and giving you the right recipe to really centralize to come back to where mindfulness is something that you practice. So this is just, kind of like an overview of the process. And in subsequent videos, I'm going to further explain the neurochemistry. So we talked about motivation last time, correct? So things like dopamine. So having less of that means you're not motivated enough, unmotivated, and that can lead to things like depression, anxiety, also having low serotonin, which has been known as the mood regulator. So being able to balance your mood, you need good amounts of serotonin. So when one goes up, the other goes down. So if you're pumping too much dopamine into the system, you may find yourself getting stuck in an addictive pattern and having less of serotonin. So that could also be something that plays a role in why you're anxious. And so in the next video, I'm going to dive in more on the neurochemistry of how we can enhance our serotonin levels and also understanding that dopamine in and of itself is not bad. It's extremely useful so that we can stay motivated and get things done in our lives. And yes, anxiety can begin as early as you being in your mom's womb. The programming begins as early as in utero. So for mothers, it's important to make sure that you feed well, make sure that you're giving the child good nutrition because you want to optimize the insulin-like growth factor 2. Low levels have been connected to anxious babies and children being later developing other mood dysregulation issues. So optimizing food, number one, good nutrition. Number two, making sure that you reduce your cortisol level, right? If your husband is stressing you out, your boyfriend is stressing you out, think of the outcome. Is it worth it to program an unborn child into this world to essentially suffer? So that is a question that you have to ask yourself honestly, reflect on that, and decide. Because as soon as that child is born, they've already been programmed, and neurochemistry just simply carries on. So they go through their daily lives struggling, something that they never paid for. So how do we feel about that? So for parents, just really be conscious about this, because this does, really pass on, and, we see this clinically. So reflect and make the right choices that you need to avoid stress during pregnancy, feed well, and most of all, just be grateful for the gift of life. Practice gratitude. Always have a smile on your face. It's going to pay off in the long run. Well, I'm your host, Dr. Ben, and make sure that you like the video and hit the subscribe button for more mental health care related videos. Until next time, thank you so much and have a blessed day. Bye bye.